It's a pleasure to present Dr. Herbert Chen as our official, non-official Goodnight Lectureship in Surgical Oncology. Dr. Chen is a native of Wisconsin. He attended Stanford as an undergraduate, went to Duke for medical school, and then Johns Hopkins for his surgical residency. Took time out for research. After he completed his general surgery residency, he stayed at Hopkins and completed a surgical oncology and endocrine surgery fellowship in 2000, and then took a faculty position at Wisconsin. At Wisconsin, he's done a couple of amazing things, building a significant endocrine practice, as well as rising through the ranks of administrative and research successes. His position at the end of his Wisconsin career was Leighton Ricker's chair in surgical leadership, chair of the Division of General Surgery, and vice chair for research in the Department of Surgery. And then he was successfully recruited to the chairmanship at University of Alabama, Birmingham, where he assumed that role recently. And with his experience in both research, endocrine surgery, as well as the strong mentoring of surgical residents, from which I've known him for the last 15 years, it's truly an honor to have Dr. Chen as our visiting speaker.
Good morning, everyone. It's certainly an honor for me to be here, especially as a Goodnight lecturer. And I have so many friends in the audience. It's great to see so many familiar faces as well. It's been too long since I've been back to California. Today I'm going to speak to you about something that I am very passionate about, academic surgery. And as we all know, academic surgery can sometimes feels like we're walking a tightrope because we're trying to balance our clinical responsibilities, administrative research, teaching, and probably most importantly, with our family life. And it's a challenge a lot of times to do this. And so hopefully in this talk, I'm going to provide some pearls that I've learned from many people over the past years, being in this for over 16 years. But I do want to credit the individuals listed here. We put together this book called Success in Academic Surgery, and all the authors are listed here. And you can see in red are some of your faculty, the Trotmans, who contributed to both editions of this book. I'm not trying to sell it or anything, but it is a great read, and so I borrow a lot of content from these authors. When I grew up, I was a huge David Letterman fan, and I think everyone in the audience should know who he is. But so my grand rounds today will be delivered in a top 10 fashion, the top 10 strategies for success in academic surgery.
Here are the top 10 strategies for success in academic surgery.
So Jaylene Grams is one of our MIS surgeons.
Number 10, start now.
So Greg Kennedy is our chief of the Division of Gastrointestinal Surgery. And so for the trainees in the audience, I think there are definitely things that you can do right now to prepare yourself for a career in academic surgery. One is to build a slide portfolio. And so whenever I see a great talk, I always ask the person for their slides. So Nipun Merchant is a great friend of mine. He gave this talk at our grand rounds. So I immediately got his slides, and you may see one or two in my talk today. And certainly for any of you who want my slides, you can have my slides. I'd be glad to email them to you at the end of the talk. Just shoot me an email or shoot an email to Dr. Bold and I'll give it to him. Whenever you see a great case or a great CT, definitely take a picture of it. Nothing speaks more when you're on the podium giving a talk about a topic and you can show pictures from actual cases that you've done. And so, like I said, build a slide portfolio. And then from your mentors, get the templates that your mentors use right now to facilitate all the things they do. All of us are going to be asked to write letters of recommendations for residents and students. Get templates from your mentors, see how they do it. Journal reviews, referral letters, and for the electronic medical record, whether you use Epic or something else, there are great templates that people have already devised, so why try to invent the wheel again? And I would encourage you to publish in your future area as much as possible. So when I started my career at the University of Wisconsin, we had a very small endocrine surgery practice. And so I went around and met anyone who would talk to me, endocrinologists, internal medicine people, primary care doctors. And instead of them viewing me as someone right out of training with no experience whatsoever, I brought them articles that I had written as a resident on thyroid, and they actually thought I knew something about taking care of these patients and were willing to send me patients as a result. So number 10 is start now.
Number 9, find great mentors.
So Melanie Morris is our chief of general surgery at the Birmingham VA. And so the word mentor comes from Homer's Odyssey, and as probably everyone in this room knows, Odysseus was king of Ithaca. In that story, he entrusted the care of his household to Mentor, who served as a teacher and overseer of his son. And as we all know, during the 10-year Trojan War, Odysseus was condemned to wander vainly. And in this quest, his son was accompanied by Athena, who assumed the form of Mentor. And as the story goes, they cast down the usurpers of Odysseus' throne. And because of this story, the word mentor became synonymous with trusted advisor, friend, teacher, and wise person. So what is the modern definition of mentor? So we would say a trusted friend, a counselor, a teacher. It's both a personal and professional relationship which develops over time. And it really, the purpose of the mentor and mentee relationship is to advance the educational personal growth of the mentee. So when I first began my career at Wisconsin, I had a great mentor, Norman Drinkwater. I was going to start a basic science lab, and he was experienced because he trained clinician scientists. He was available, read all my grants, but really he was comfortable. He was not seeking to advance his own career. And what's an amazing thing, I keep in touch with Norman, great person, a friend as well. And to this date, I spent my first 18 months of my career in his lab, where he took me on, gave me space, helped me with my papers. And to this day, he and I do not share a single publication together. Our names do not appear in print anywhere. And so when I first gave him my first paper from the lab and I put his name on it, he told me, "I want you to take my name off of it." And I said, "Wow, is it really that bad?" I mean, and he goes, "No, well, it's a great paper, but if I put my name on it, people will think this is my work and it's really yours. So I want people to recognize that this was your idea and the work was really yours." And I truly very indebted for him. It made my tenure packet go quite easier. And I try to do the same thing for my trainees as well. When I first came to UAB, we didn't really have a formal mentoring system. And so I asked Marshall Uris, one of our senior surgical oncologists, to take this on, where we then developed this program for our assistant professors. And so with this program, what we did is we assigned every assistant professor a mentor. But importantly, that person had to be outside their own division. And the rationale behind that is because that obviously assistant professor will be mentored by people in their division, but there are going to be some times where the goals of the division are in conflict with what's best for the individual advancement of the young faculty member. So by doing this, we sort of take that conflict of interest away and really give the assistant professor someone who can really advocate for them and have their best interest at heart. And so we choose someone outside of their division, but in a similar area of focus. So if they're a clinical person, a researcher, and so forth, and they're supposed to meet at least every 6 months and provide feedback, and they write a report that centrally goes to Marshall Uris and I, again, to review the progress. And again, the goal is the advancement and promotion of the mentee. So number 9 is find great mentors.
Number 8, obtain the right equipment.
So Jeff Kirby is our director of acute care surgery, formerly our trauma division. And so I don't probably have to tell anyone in this room the importance of having a smartphone, but it's still amazing to me today that not all of my faculty have a smartphone. And in fact, in my old job, not all of my faculty even had a phone, which I couldn't believe. But probably all of us cannot live without our cell phone. But how many times do you see people that run out of power on their phone and they're asking you for a charger because they can't, they have no power? So I think that should really never happen because chargers are so inexpensive. So I have a fleet of chargers in wherever I go, in my office, in my at my desk, in my bag. I have a couple in different suitcases I have because you should never run out of power. But now I have, you probably know what a Mophie is. I've had a Mophie on all my cell phones, but I had to get an iPhone 7, and the Mophie for the 7 isn't available yet. But and this was Oprah's favorite thing in 2013, as you can see. But so Mophie is a battery charger, so you never run out of power with your cell phone. So this is a key piece of equipment that I carry with me all the time as well. And this is, it's called an outlet adapter. It costs about $5 at your hardware store. So how many times are you at the airport where everyone is competing for the only outlet that's by the gate? Or you're at your hotel room and there's only one outlet by the bed and you and your spouse are battling whose iPhone gets to be plugged in for charging. So this takes that out of the equation because it converts one outlet to 4. So it creates marital harmony, one. But then you can definitely power whatever you need at the airport. So I showed this to my faculty, and our chief of vascular surgery texted me this picture here where he had bought his own outlet adapter, a different shape, and was using it at the airport and sharing with friends around them. So, so I always carry one, and I bought my wife one as well. So number 8 is attain the right equipment.
Number 7, use the web and media effectively.
So Mike Chen is our director of pediatric surgery, our surgeon-in-chief at Children's of Alabama. So one of the things when I came to Alabama is our website was horrible. It was outdated. There was a whole bunch of inaccurate information on it. So really put some effort to develop our website with a mission and vision statement. But we also decided to partner with the health system to make sure we were getting all the information out about what we did. So obviously I have an interest in thyroid cancer, so I made sure that site was up to date. We worked with them to create a lot of informational videos that we post on both the health system and the department website. And
thanks for tuning in
this
today.
is one by Melanie
I'm
Morris.
I'm an associate professor of...
And I hired 2 people to run our communications office. A woman, Megan Yates, who had just graduated with her MBA, and her assistant. And we created a lot of other videos that we utilize
I think
for
if you
promotion.
ask any,
And so this is one for our residency
why they
program.
went into academic medicine, I think almost all would say that the reason they're doing it is because they want to train the next generation of surgeons. We want to train.
And so
ABC 3340's
we
Laura
work with
found
the
out UAB
local media to
hospitals
get
in the
stories
nation
out
first
about what
turn
we do for our
southeast
surgeons
to
and try to
perform
be
an
on the
HIV
news at
positive
least
kidney
once a month.
transplant.
So that's just one example.
Man with HIV needed a kidney transplant. Doctors say because of factors including his blood type, he faced another 7 to 8 years to wait to receive.
And then we work with professional videographers to really try to market just not only in Birmingham, but throughout the state of Alabama and the region. So these are all facts about Birmingham that you're learning about too.
The UAB Comprehensive Cancer Center is one of the...
We have a very active Facebook and Twitter page, so I invite you to follow us on Twitter and to like us on Facebook, because our media team is actively posting anything about our department. And we have a Throwback Thursday where we show great old pictures from our department. And we also advertise within the whole health system within the hospital. So we decided that we were going to market our department, so we posted all these video boards across the hospital. And we did this in combination, in collaboration with the Department of Medicine. So we alternate slides about the Department of Surgery and Department of Medicine. So now everyone across the hospital sees what our departments are doing. Now everyone wants to get their own video board up across the hospital. But really, it's really to highlight everything that our faculty and residents do. And then we also use the website to advocate for research. So we have had all our researchers develop a lab website. So this is my lab website here. And we post fun things like this on there. I wonder what the lab is up to.
I stay up too late.
And it's actually a lab member singing, so you can probably tell, not professionally
That's
done.
what people say. That's what people say.
So why post a video like this on your lab website? Well, it's very interesting because obviously you won't believe how many people actually watch this. The website gets a ton of hits, and I think what people see is that, you know, there are a lot of people looking for places to work, right? And they see, wow, this lab looks like they have fun with what they do, right? I want to join that team. So what's very interesting, so we have information about our lab website that provides the facts of what we do. But I have had over 13 postdocs come to our lab, all funded, usually from overseas, who are just looking for a place to land, a place to spend a few years doing research. And they actually come to us because that they see our website, see what we do, and see, hey, maybe this is a fun place to work where I would really enjoy spending time and also get some serious work done. So number 7, use the web and media effectively.
Number 6, follow your gut.
So Devin Eckhoff is our head of transplant surgery. Oh,
Number 6.
didn't mean to do that. So what do I mean by follow your gut? Well, I study neuroendocrine cancers, and we all know those are hormone-secreting neoplasms that develop mostly in the gut, known as carcinoid pancreatic islet cell. And so when I first began research in neuroendocrine tumors, this is what a lot of people told me, that they thought I was really stupid to do that. Because if you look at all the funding that's given, and this is slide's a little old data, but probably true today, that most of the research in cancer is going to breast, leukemia, prostate, and if you look at neuroendocrine, it's way down there. And they said, you shouldn't do that because you will never get any funding because it just doesn't exist. And if you look at the leading sites of new cancer and cancer deaths, neuroendocrine appears nowhere on that picture. But you know, I did follow my gut and I decided, well, you know, neuroendocrine cancer, they're rare, but we need further therapeutic treatments because surgery is the only cure. And further of all, we know a lot of patients will have horrible symptoms from the endocrinopathies associated with neuroendocrine tumors, so we need palliative options as well. So I have a lot of experience serving on grant review committees for the NIH and other foundations, and what I found in this experience is that probably the most important thing is when you write a grant or decide to do research is you're passionate about it and you can tell people why it's important. So these are some critiques from my grants. So neuroendocrine, they acknowledge that neuroendocrine cancers are rare, but they said that it's a translational, well-defined, highly worthwhile, significance is high. This is a worthwhile goal as it will have profound implications for the management of neuroendocrine tumors. And they say that these are refractory tumors. The potential significance of this application is high. So I think if you follow your gut and really tell people why it's important to study the question you're interested in, I think they'll buy that. So number 6 is follow your gut.
Submit a lot of grants.
So Liz Byerly is one of our pediatric surgeons, and she definitely submits a lot of grants. And so when I think about writing grants and submitting grants, I often employ this baseball analogy, is that a home run is like a funded grant. So if you use this analogy and you look at Major League Baseball's home run leaders, listed here in order, you can see that they are also the strikeout leaders. In fact, here's home runs in this column, and look at how many strikeouts here. And Reggie Jackson, Mr. October here, you can see that he has 5 times as many strikeouts as he does home runs. So why is that? Well, these home run hitters are really swinging as hard as they can, right? They're trying to go for it all. And they're willing to strike out because they know 1 out of 5 times they will hit that home run. And so why is it important to write a lot of grants? Because I think it puts your ideas on paper. As surgeons, we have the great ability to send them to surgical societies, which only surgeons are allowed to. Then you can go to the NIH. But really, the number of funded grants is directly proportional to the number you submit. So I encourage our faculty to try to get something in on the cycle and to really grow tough skin and resubmit that grant addressing all concerns. So during my first 8 years on the faculty at Wisconsin, our team submitted 163 grants. And of those, we got 41, so the funding rate was about 25%. But that means for every one positive grant, I got rejected 3 times or got slapped in the face. Now that's a little better than Reggie Jackson, who was 1 out of 5. But still, 3 rejections for every positive result. So this is a great quote that I think summarized it by Mickey Mantle. During my 18 years, I came to bat almost 10,000 times, struck out about 1,700, walked 1,800. You figure a ball player averages about 500 bats a season. That means he played 7 years without ever hitting the ball. And that's what it sometimes feels like when you submit grants, that you're not ever making contact. And when you submit a grant, sometimes you get comments like this. And these are actually comments that I've received on my grants. You can see this proposal lacks serious consideration, put together in a hurry. A more focused research effort is more likely to benefit this relatively young investigator. And I was already 10 years into it then, so I'm glad they thought I was young. The lack of detail in this application is concerning regarding Dr. Chen's qualifications as a PI. Ouch, isn't that painful? And they said that because of, and this was the rationale, because of my detail. There are multiple errors in the list of references, including repetition of several publications. So my reference manager put one reference twice accidentally in the reference. But because of that, the lack of attention to this detail is very worrisome regarding the likelihood that I will successfully complete the proposed work. So why would you ever want to submit a grant if this is what you get, right? But I'm showing this because I'm telling you everyone gets stuff like this. And what you need to do is you need to ignore this, although difficult it may be, and just focus on the stuff that is really contains content, and just address that and ignore this. Because I think success, this is a great definition from Winston Churchill, success is going from failure to failure without loss of enthusiasm. So number 5, submit a lot of grants.
Number 4, join surgical societies.
So Tom Wong is one of our surgical oncologists. And so I just want to tell you about some of the societies that I feel very passionate about. And one is the Association for Academic Surgery, which I've met a lot of. I think it's where I first interacted with Dr. Bold, Trotmans, and many other Hung Ho. And so I think it's a fantastic organization, which I encourage all our young faculty and residents to join. So the AAS, their big meeting is in February, along with the SUS. This year it's at Vegas. It was founded in 1967. It is the largest organization of academic surgeons in the world. And they do great things, and you can be involved right as a resident, a fellow, or a young faculty member in all the things they do, teaching in their Fundamentals of Surgical Research course and Career Development course. We send a pretty large contingency. That's us last year at the meeting. This year we have 68 abstracts at the meeting, so we'll have a large contingency from UAB. And the great benefit of the AAS is you meet people who are trying to do exactly what you're trying to do. Young faculty members, residents, trainees from all over the country who are just trying to succeed in academic surgery, figuring out a way. And so many of my lifelong friends are met there. Many of my golf buddies. I've traveled the world with a lot of fellow AAS members. And the nice thing about the AAS is allows you to get involved in committees early, and all the leaders are young people, because after a certain period of time, you can't be an active member anymore. So I would encourage all of you to join the AAS. The second organization that I love is the American Association of Endocrine Surgeons, so my subspecialty organization. So I would encourage you to get involved with your subspecialty organization. And especially a lot of subspecialty organizations have social events. And I would encourage you to do those, which some people skip the social events and do other things. But the key about social events, it allows you to meet people in your field in a different setting. So as endocrine surgeons, we like to think of ourselves as very friendly. So we have a golf outing, we have a run, and we also have a tennis outing. And so I'll tell you just a brief story about this tennis tournament one year, that I was paired with R-Tier, who has an amazing serve. We did actually very well in the whole tournament. And I didn't really know him at all. I knew his name, but we spent hours on the courts together, got to know each other very well. And a few weeks later, I get a letter in the mail from his chair asking me to do his promotion letter, which I gladly did, and he got promoted. But I would guess that I probably wouldn't have gotten asked to do that letter had we not interacted in this tennis tournament, where I learned so much about not only how good of a tennis player he was, but I learned about all the things that he was doing in his work and how important his role was in his health system, everything. So I would definitely encourage you to use the social events to get to know as many people as possible in your field. Another organization which a lot of people don't know about is called the Society of Clinical Surgery. It's considered one of those secret societies, so I wanted to bring it to your attention. It is founded in 1903 by Harvey Cushing. There are only 60 active members, and you have to be sponsored and you have to get in the club before age 45. It was the first American surgical travel club, and it's hosted by a different academic surgery department each year. And what's really unique about this meeting is the membership travels to an academic department, and they watch the surgeons operate in that academic place. And here's a picture of some of the great surgeons who have been involved. This is a little description by Mayo, Ochsner, Cushing, and Mumford, who described the inception, basically saying that it's more fun to watch surgery than to sit in a lecture hall and listen to talks. We were very fortunate to host this meeting in 2015. This is just a picture of some of the active members who were in attendance. But again, a great society to belong to because you meet so many people, you travel around, and if your institution has never hosted the meeting, I would definitely advise you. It's a fun thing to do because you have so many leaders in American surgery that come to the meeting and get to know your surgeons. So number 4 is join surgical societies.
Number 3, publish papers.
So Jamie Locke is one of our transplant surgeons who's great at publishing papers. So why do we publish papers? Well, obviously they're required for promotion, establishes your expertise, shows productivity for your funding, brings recognition to the department, and as a trainee allows you to get fellowships and jobs. So I just wanted to show you this paper. It's a paper that I never wanted to write. So my mentor, Rob Udelsman, came to me when I was in my chief year at Hopkins and said, Herb, I have a paper I want you to write. It's on this new minimally invasive parathyroid technique that I do. You can do it. And I said, well, Dr. Udelsman, I'm a chief resident at Hopkins. I'm just very busy. I can't do this. I have no time. I'm trying to get a job. There's just no way I can potentially do this. And he really pushed me and says, you have to do this. And so being the dutiful resident, I did the paper. And obviously it got published. It's just a 33 patient series, right? Small paper. So if you look at my CV, I've had the privilege of publishing in PNAS, Nature, and those are the number of citations those papers have had. But do you know what the number 1 cited paper on my CV is? It is this paper, a 33 patient series, which I never wanted to write. And why I show this is because not only is this my most cited paper, it is the paper that made my clinical career, actually, because when I brought this paper around to referral docs at Wisconsin, they had never heard of this. They sent me a lot of patients. So the parathyroidectomy is the operation I have done the most of any operation that I do. It was my busiest operation at Wisconsin. At UAB is my busiest operation till, because my mentor had the foresight to ask me to do this paper. So for the trainees in the audience, if your faculty member asks you to write a paper, you should write the paper. But what are the obstacles? Well, sometimes it's time. So my former chair that hired me, Bing Rickers, used to say, if you have enough time to get up early to go to the gym at 4:30, you have enough time to get up and write your paper. But again, sometimes we get into this cycle that, the paper's not ready, we need more data, it's just, I can't do it right now. But you just got to break that cycle because the paper could always be better, right? But just submit it. You have to draw the line somewhere. And what I am surprised as being an associate editor for a few journals, when people send papers, they don't send any recommendations for reviewers. A lot of times as an editor, I will struggle to find someone to review your paper because everyone's busy. If you give me a name of someone that I may know, and you're going to choose actually someone who's going to be good to your paper, hopefully, I'll probably take that person as one of the reviewers because I need someone to do that job. So when you submit a paper, suggest reviewers. And if you can suggest someone on the editorial board, that's great. And again, rejection. Everyone has papers rejected. And so you just need to see if you can address the comments. If you can, just reformat it and send it somewhere else. You've already done the work. You should get credit for it. And once you submit a lot of papers, you can get on editorial boards because it's good for promotion. It increases your chance to get your paper published. You have an impact on the field. And so for Annals of Surgery, which is the journal that I work with a lot, and you can see people in Gray's Anatomy even read Annals of Surgery, as shown here. And then when you want to get on the editorial board, ask your editors to send you a paper. So if you want a review for Annals of Surgery, send me an email, and I will send you a paper to review. And accept my invitation, do it on time, and after you have done a lot, then you can ask your chair to put you up for an editorial board. Now, the Journal of Surgical Research, I think, does this in a very fair way, is that if you review for Journal of Surgical Research, they look at how many total reviews you do, and they'll draw the line and say, hey, listen, all these people above this line who did 20 more reviews, we're just going to put on the editorial board. So a way to get on is also do a lot of reviews on time. And this can also happen too. Dr. Decker wrote a great review for the Journal of Surgical Research. So the editors decide to invite her to write a commentary, a single author commentary on the paper she reviewed, which she did. So who is Dr. Decker? Well, at the time, she was a third-year general surgery resident at the University of Wisconsin. And she still reviews for the journal today. So even for residents in training, I would invite you to put your name in to review a paper. So number 3 is publish papers.
Number 2, apply for traveling fellowships.
So Dan Chu is one of our colorectal surgeons. There are a lot of traveling fellowships that are available to surgeons, and I'm just shocked how many people don't apply or how few applications we get. The AAS has a traveling fellowship to Taiwan, Australasia or Australia, New Zealand, Colombia, and West Africa. The James IV Association, which maybe some of you haven't heard of, is an organization which actually chooses travelers to travel around the world from the United States. It's a 6-week fellowship that they give you money to travel for 6 weeks. You can bring your family. And how you can be nominated for this is you need a letter from your chair and a letter from an active James IV member, which if you go to the website you can see. These are the list of travelers from the United States. I was honored to do this in 2004. And when I did this, I went to all these places listed on the side with my family. It was a fantastic experience. One of our surgeons, Jamie Locke, who I showed you a video, just recently was awarded the James IV, and she'll do that next year. There's a traveling fellowship from the American College of Surgeons. There's one to Germany, Japan, and Australia. I used to chair this committee. We hardly had any applications, which I was just shocked, is because here's a great opportunity for you to travel the world on the American College of Surgeons. And so the deadline is November, so you have plenty of time for this year. So the great experience is I got to meet a whole bunch of surgeons across the world and actually scrub with them and go to the operating room. So these are pictures from surgeons from across the world who are very close friends because of this traveling fellowship. But perhaps just as important, I brought my family. So how many kids can say that they petted a koala, went to an Australian rugby game, went diving on the Great Barrier Reef, landed on a glacier, and petted a kangaroo? Probably not that many, right? But my kids remember this vividly. My kids are like 20 and 22 now. but they look fondly at this time that we spent together traveling and all the unique experiences they had. And this was all because I'm a surgeon and I applied for a traveling fellowship. So number 2 is apply for traveling fellowships.
Number 1, feed your family.
So Marty Heslin is a surgical oncologist, my executive vice chair. So what do I mean by feed the family? Well, I do want to make another plug for Birmingham. That has to go with food.
The country voted, and now Zagat is counting down America's next hot food cities. In first place, it's Birmingham, Alabama. This southern contender took the top spot due to a delicious combo of fine dining, barbecue, and a fresh batch of more casual restaurants. The food culture and the city itself has changed dramatically in recent years.
You have more people coming to Birmingham from different areas of the state, of the country. They come to Birmingham and seem to fall in love with it.
It's not transient. The people come and they stay.
All right, but that's not what I mean by feed the family food. But what I mean is, so, and this is probably best put by the chair who hired me, Bing Rickards, the first obligation of a young faculty member should be to the family, not to the department. And he really encouraged us to integrate our spouses into all activities. Like, I brought my spouse on this trip, and she's had a fantastic time here. What I try to do, I try to either text her or email her or do something multiple times throughout the day to let her know that, I'm thinking about her. And we try to set at least one night a week where we can do something. And we did this especially when our kids were young. And that's my wife, Harriet. So my wife's a photographer. And so when we took the first job at Wisconsin, we wanted to make a commitment to her career because she had sacrificed so much to allow me to do my training and basically raised our kids in the beginning when I was taking call all the time. So what we did is we decided she would develop her business, and so this is an example of some of her work, but I found myself on some weekends holding light reflectors, dealing with kids who would not pose for pictures and stuff with her. But it was a lot of fun assisting her as she developed her career. Now, when one of my passions is golf, and I have this annual golf outing. You can see this is a group, which 24 guys, we go all over the place. And so when I talk to these guys about what's important for them and what they do, many of them are trying to find something to make their golf game better. And so they come up with a whole bunch of new equipment. They come up with these videos which take a picture of their swing and I analyze it. And so, but if you ask anyone, what is the most important thing in your life, maybe some of them would say their golf game, but probably they would say it's their relationship with their spouse. Yet we spend so much time trying to make our golf game better and things like that, but we don't spend so much time trying to make our relationships better. So someone came up to me, a good friend, and suggested that I read this book. And it's sort of ironic because I don't really read much other than surgical stuff. And I definitely don't read books like this. And so they said, you have to read this book because I think that it will make your relationship better. And I said, I'm really, really skeptical. And so, how this book goes is the 5 languages of love. Says there's 5 different ways you can communicate with your significant other, and these are the 5 languages. And so I acquiesced, and I actually got the book. I read it, and I had my wife Harriet read it, and it really made sense after we read it because our languages of love were different. Because for me, being a surgeon, I'm very acts of service oriented, whereas my wife is a quality time person. So what was happening with our relationship, and maybe many of you are familiar with a story like this, is that you're working, you're getting the text, when are you going to be home? I say, I'll be home in a half hour, when it's really probably going to be an hour. And, by the time you get home, you know that you're already in trouble because you're way past what you're supposed to do. So what I was doing is, I pull in, I go, geez, I am in trouble. So being very acts of service, I would go in there, I'd see there'd be a pile of dishes, I'd start doing the dishes and getting things clean, And she was just getting more pissed off at me as I was doing this, because what she really wanted was quality time. She wanted me to come, sit down, ask her how our day was, and just talk to her after getting home. So we read the book, and we talked about this, and so I changed my behavior. So instead of doing that, and I'm late, I just start talking to her, and it's much better because of that. And plus I don't have to do the dishes now, which is like a great reward. So I would definitely encourage you to do things like this that make your relationship stronger. And I can't overemphasize the importance of being involved with your kids' activities. And I had a great role model when I was training, Keith Lillimo, who is now chair at Mass General, but he was our program director at Hopkins. And you'd operate with him, and he'd be talking with you about what sports event he was going to that evening, and just all the activities, and how he balanced his very academic surgical career with being very, very involved with their family. He encourages us to coach our kids' teams, so I did that. I coached my daughter's soccer team. I knew nothing about soccer, but at that age, you just have to bring the cones and the treats, and you're all set, and so it was an easy job. But my daughter remembers me as her soccer coach, which is really amazing to me, because I did not know what I was doing. But I often see this conflict with faculty members, which I try to encourage them to get their kids' events on their calendar early. So what I would do when my kids were really engaged, my son was on the tennis team and did theater, and my daughter played soccer her whole career and also did theater. So when before the season, I would be emailing the coach just incessantly so I could get the schedule for the season, so I could put that on my calendar. And whenever my kids tried out for a show, I had to know when the opening night was, and that was on my calendar. And so my assistant knew that if my kid's event was on my calendar, nothing was going to be scheduled during that time. And I put it on months in advance, so there's just no way that they could not know that my kids had an event. So I was able to go to virtually all my kids' events because I scheduled my travel around it as well. So an incredible thing happened because of my preparedness is that, so my daughter, Liz, who was right here, when she was a freshman, her soccer team was like, they were not predicted to do very well. They barely broke 500. But a weird thing happened as they went through the state tournament is that they just started upsetting every team ahead of them. And it just kept on happening where they went all the way to the title game and actually won the state championship when my daughter was a freshman. So just fortunately, I'd blocked off even the playoffs, which is, I know, a stretch, but it was all blocked off on my calendar, so I had to drive to Milwaukee and everything. But my wife and I made every one of these games, and obviously their team never won the state championship again, but it was a great experience to be able to live this with her. Again, because my schedule was cleared way in advance for this, and I never had a conflict. So in closing, I think as surgeons, we have the greatest job. We get to do amazing things with robots, technology. We take care of patients. We do research. We teach. I think it is the best career anyone could have. And so I'll just close with a quote for John Cameron, who was the chair at Hopkins when I trained, would say this to us every Sunday morning when we had conference with him. And he would quote Ernie Banks. Ernie Banks is the best player in Cubs history, and one who rejoiced in the game and showed the enthusiasm of a dedicated Little League player. He often commented he couldn't believe he got actually paid to play the game. And that's what Dr. Cameron would say to us every weekend, that he actually couldn't believe he got paid to be a surgeon. So really inspiring, and it is, I think, the greatest occupation. So I hope that I've been able to just impart a little bit of just my tips for success in academic surgery, and I'd be glad to take any questions. Thanks.
Herb, thank you so much. Really, I apologize about my voice, but there's no doubt, it just is the best the best career there possibly is. And thank you for sharing all those great, really practical tips. You know, really great advice. So we do have a few minutes for questions. We'll start with Dr. Goodman.
Dr. Chen, you've been a role model of a modern surgical chairman for now, I guess, 16 months, but your whole career as a role model. I think the tips would apply to a busy professional career, whether surgery and so forth, just priorities and so forth. A question that occurred to me as you were talking in your mentor program, which you've developed now over the last 16 months and so forth, Dr. Uris is going to be a critical piece. As you think about it, how will you evaluate the mentors? Undoubtedly, over time, you'll begin to call the group of those groups that are really quite successful in that role.
No, I think that's a great question. Since we learned, we tried to pair every faculty member as a mentor, and you're right, there are some people who do it better than others. And so one thing that I do is I have a yearly faculty chat with all our faculty. And so I'm right now doing it again, the second. And so I'm sharing some of the feedback to the associate and full professors who are doing the mentoring thing about asking them how they're doing, but also giving them feedback about, how their letter was organized and how often they're meeting and this perception of the active role they're taking. And then what we're doing, we're actually taking another step for an associate professors. We're trying to set them up now with professor mentorship. So the next phase is to try to mentor the mid-level mentors who are trying to do the best they can by pairing them up with more senior people to help them. So that's phase 2 that I've asked Marshall to do, and he's just started to do that.
Good faculty folks.
Yeah.
Dr. Pooh.
Great lecture. Very much. I have a question to ask you about, there's so many things in your life you have to do. Obviously as a surgeon, academics, it's not easy. And how do you recommend us how to balance the life? Just in general, I know you put a family, things important, but it's in the reality, it's not easy. How you balance your life? You have a family, you have your career, you have a clinical practice, research, academic activities, how you actually balance your life? I mean, only 24 hours a day.
All right, there's only 20. No, I agree, and I think you have to make choices, and I think that part of the balance is being very organized. I talked a couple things like I have been always a big advocate of taking charge of your calendar, putting the events that mean the most on you, and so there's no conflict with them, but sort of blocking your time out so you can focus on certain things. I think if you're very obviously well organized, you can do much more and take advantage of all the time that you have in the day. So if I'm sitting there doing, like I'm waiting this morning, I got up a little early and I was waiting for Dr. Bull to pick me up. I was like banging out emails and getting I reviewed a paper this morning and did things on the downtime that you would just sit there and do nothing. So then, like when we fly back today, I can actually have a conversation with my wife as we sit on the plane, and all that stuff I would have done while we were together now I'm doing during. So finding gaps of time where you can do that stuff. But I guess it does come down to you just can't do everything, and you're going to have to learn to say no to some things. And so that's what I think it's great having a mentor that you can ask, but also one that can advocate for you. And so I think key to our mentoring program, so let's say you're a young faculty member and your division chief says, I need you to serve on this committee. And sometimes you're uncomfortable telling your boss no, but you can then go to your mentor and say, hey, listen, they've asked me to do this. And your mentor can say, that's not good for you. You need more time. Let me talk to your division chief. And so now it becomes the mentor advocating, saying, listen, they don't have enough time to do this. So that's what I think, that's why we designed it, because we want a way for the faculty to be able, the young faculty to be able to say, listen, I just can't, I've reached my limit, and to have a comfortable way for them to do it. But what I tell also to our young faculty members is when you're young, you try to do as much as you can, but once you get promoted, my conversations with them, okay, now you can really do the things you really, really like to do. You don't have to say yes to everything. necessarily. You can say much more. You can say no to a lot of more things.
Do you have a writing habit? So a lot of people try to write 15 minutes, a half an hour every day, just something, just to get that discipline. Is that a technique you use?
Well, I was not a good writer to begin with. So I always joke that my English teachers would just be surprised that I write so much now. But so I tend to write best. I can write anywhere, so I will try to write on the. So I have to write like 3 promotion letters. I will do it on the airplane back because, again, that's time where I think that often people would waste. So I try to do all my writing and stuff at times where I wouldn't be, that I can't do something else. But I guess it turns out because I probably spend about an hour a day writing, whether it be emails or letters or something like that. So definitely, once you get the hang of it.
I think that's one of the challenges for academic surgeons. You've really got to write. You got to write grants. You got to write papers. You got to write. And a lot of people went into science because they didn't think they liked to write. Otherwise, they'd have been an English major or something. So getting that habit back, I think, is really an important piece that's hard to do. And it's overcoming that activation energy and not worrying if it's not perfect, because your editors will fix it for you. So, I think that's true. Dr. Brown.
What advice do you give your junior faculty who are fresh out of training in terms of balancing building their referral base and their clinical practice, and then applying for grants and building that academic career concurrently?
Great question.
Yeah, I think that's. So when we hire junior faculty, we try to make it clear what their primary area of emphasis is going to be. And so how I feel about this may be a little different than some. But I think if you're hired primarily, if the goal for you is to get, let's say, an NIH funding, whether it be health services, translation, or basic science, we try to carve out 50 to 75% of protected time for that person. So I'm recruiting a surgeon. I'm recruiting an endocrine surgeon right now. And during that recruitment, I asked her, how much time do you want to spend? And she said, well, I want to spend like 50 to 60% of my time doing clinical. And I had just previously asked her, what's your goal? And she goes, well, I want to be, I want to have a funded education research program. And I said, well, if you want to do that, you're going to need to spend at least 50 to 75% of your time focusing on that in your first 3 years. She wanted to operate 2 days. You shouldn't be operating 2 days a week. You should be operating 1 day a week at most and doing a half-day clinic. And so after talking to her, she agreed. And so her offer letter says that she's going to do 1 clinical day in the OR, a half day in clinic, and the rest she's going to focus on that. So that's how we try to construct for people who are very research. Because my own belief, that's what I did. I focused on my research first, and I slowly built my clinical practice by going around speaking to people. And so by the time the referrals started kicking in, I'd gotten my first grant and stuff. And so I tell them, for your first 3 years, focus on your primary. Now, if you're hired to do primarily a clinical job, then we got to, it's totally different. Then we've got to design it where we get you out on the speaking circuit, out speaking with many providers as possible, doing a lot, having you give some talks, and we put on the website so we can start to market you and get you busy clinically faster. But for the academic, the ones doing research, we put that off at least a couple of years before we do that. Does that answer your question?
Well, it's great. Thank you again so much for visiting. Sharing a great.
My pleasure.
Really great.